We are now in a situation where we are coexisting with COVID-19, where we do not have to choose between either returning to jobs or protecting health care. We do have the tools and the strategies in place where we can achieve both of those ends. Jobs can be maintained without jeopardizing the health of a community if everyone follows the safe strategies to prevent the spread of COVID-19. The more that Texans protect their own health, the safer our state will be, and the more that we will be able to open up Texas for doing business. Now listen, I know that an issue on the minds of a lot of people in the state is the issue about hospital capacity and our ability to make sure that we are going to be able to treat anybody who tests positive for COVID-19. The good news is I have good news for you, and it will be explained to you by Dr. John Zerwas.
We are now at about 15,000 beds that are available. So still nearly twice the number of beds are available now that were available back in mid-March that could be available for COVID patients. This represents about a 78% increase in all of our patients, all of our beds out there. Statewide, in the next slide, what you'll see here is the total beds available, again, nearly 15,000. The total beds reported in our healthcare system is almost 55,000.
There are 5 categories of response level with regard to hospital beds. The most emergency level would be level 1, and the safest level is level 5. Do I understand correctly that we are still at level 5 at this stage?
We are managing the entire population of the entire needs of patients within the level that hospitals maintain staff beds.
Okay. The bottom line is this, and that is the increased occupancy of hospital beds. It does raise concerns, but as shown today, there's no reason right now to be alarmed. The reason is because even though there are more people hospitalized, we still remain at the lowest threat level in our hospital capacity. We have plenty of room to expand beds. There are thousands of hospital beds that are available as we speak right now. And then there is the ability to surge even more hospital beds if they were ever to be needed to respond to COVID-19. And then also we still have the tool available to us to reduce non-essential surgical procedures if we needed even more beds. As Dr. Zerwas explained earlier, we did have the opportunity to get a robust update from hospital CEOs around the state of Texas. These are professionals who are accustomed to managing the availability of hospital beds, and this is nothing new for them whatsoever. And they expressed confidence about their ability to continue to make hospital beds available for Texans who may need them because of COVID-19. The last thing that I'll point out, and that is people need to recognize successes that are achieved along the way. You remember that I had a press conference a couple of weeks ago in Amarillo where we were talking about surging in supplies and tests and response to the overwhelming number of people who were testing positive in that region because of outbreaks at meatpacking facilities as well as some nursing facilities. And if you look at what has happened since then, there has been a steady decline in the number of people testing positive. There has been a steady decline in the number of people who are hospitalized. And so Amarillo is an example of the results that we see when we deploy the strategies we have available to us to respond to outbreaks of COVID-19 around the state of Texas. We remain flexible with all kinds of strategies to make sure that we will be able to continue to contain COVID-19, to continue to provide the health care that's needed for anybody who tests positive for COVID-19, while we still continue the process of opening up Texas for employees to get back to work, to earn the paycheck they need and they deserve to pay their bills and take care of their families.